was inquiring at what age or months can a baby be operated in case of undescended testicle? Thank you. This is a parent, I think, inquiring.
Yes, so undescended testicles should be operated as soon as possible. It must be moved down into the scrotum as soon as it is noticed. But there are those few cases where it's as a result of delay in the movement, which is a normal delay in the movement. So because of that, they move by themselves after a few months. So within about 2-3 months, you should be able to see the testicles appearing. So we usually recommend that within 3 to 6 months, we should be able to do that operation.
Okay.
Yeah.
Thank you so much. I think you've got the feedback. Doctor, another question here from Jackie. She's saying, I have all my tubes blocked, doctor. Which medical solutions do you give me? Yeah, blocked tubes, both tubes blocked. As I described before, we have to assess where the position blockage is and what extent the blockage is. Sometimes we can correct them, but sometimes we don't have to correct them. We do IVF. Okay. And of course, we also have to consider other factors, because if somebody is very young, maybe he's about 25, 30 years, and the blockage is not too much, then you have more reason to do the unblocking. Okay. But if somebody is maybe 35 and beyond, and there is some blockage, now you see you'll need more time for them to try after unblocking. So it becomes more logical to be more radical, and you go for things like IVF. Thank you. Yes. Jackie, I'm sure you've got your feedback from doctor. So again, what I can say is that this discussion has to be face-to-face with the doctor. Yeah, a fertility specialist has to guide you on what the way forward is. Okay. Yes. Thank you so much. Our next gentleman is saying, Kawoya from Nansana. I'm stuck. I've been trying to conceive with my wife for a year, but not married yet. But I don't see any change, and I think a problem we might be having a problem. I've been treating, is it cystitis? Cystitis. I think cystitis. That's a bladder infection. Oh, maybe the way he has written it. The doctor says that the doctors say, but I didn't see any change in me. While I have any hope. Will I have any hope? Will I have any hope? I think maybe that's what he meant. Yes. Yeah. So cystitis, he's referring to infection of the bladder. Now, yes, Mr. Kawoya, you say you've been trying for 1 year with your wife, and I think you are trying actively and nothing is happening. Definitely that is a call for concern. It's very rare that blood infections will be severe enough to cause for you issues with your fertility. So you need a proper systematized assessment of you and your partner. Full evaluation. On your side, you need your sperms to be evaluated. Again, of course, in the hospital. Yes, you need your wife to test her tubes. Of course, it's still in the hospital, and the womb has to be evaluated, and if possible, also her hormones. So these things have to be done, and the 4 questions of how the sperms are, how the eggs are, how the tubes are, and the womb, how it is. So they should do it collectively as a couple. To have, yes, they have to go together. They see the doctor does the story, and then does the tests. Thank you so much. She's saying she has a 12-year-old grandchild. Yes. I think the testicles are maybe, I think they're shrinked, something like that. Yeah. They started when I think the child was 7 to 8 years. But for now, sometimes, it is very normal for a male child to wake up in the morning, to erect when they wake up in the morning, especially morning time. But this child does not erect at all. What could be the problem? Is there any hope for that child? Yeah, so of course that is a concern. 12-year-old is a little bit young for you to conclude about the erection behavior. Because she's saying it started 7 to 8 years when he was around that time. Age. So for the evaluation of the erectile function, I think she really needs that child needs the doctor to assess. Again, also for the testicles, if they are small and they are shrinking, these are some of the cases of where somebody had maybe mumps before,
And so maybe there could be still an opportunity to rescue her or him, and to rescue him. And so I think this needs a proper assessment and a more urgent one. Yeah, we have to. He has to take that child to the hospital for evaluation.
Thank you.
Could be the nearest hospital and find a doctor to examine the child properly. So that this is sorted out as soon as possible.
Thanks so much.
Yeah.
Hello, Dr. Andabati. Thanks so much for the show. It is good to. Is it good to do SHG? Is it HSG the second time after 2 years if the first one showed one blocked tube? Can there be changes in the blocked tube over time? Can the radiation affect me because I did the test already? This is Chisache.
Okay. Yes, that's a good. Those are good questions. Yeah. So if you did HSG 2 years back and up to now you haven't conceived, it's okay to repeat and see if the doctor so requires that you repeat it, because even without treatment sometimes the situation could get better, because the body, as you know, from any illness, the body tries to recover itself, and this same thing can happen for the tube. Even if they were badly blocked, even if they were both blocked, they can unblock themselves. So it's a good idea. 2 years is a long time. Things could have changed. So if the doctor saw things that they need to reevaluate your tubes, it's okay. In terms of the safety, yeah, it is fine. That brief exposure to the radiation is not a big problem, because also the current X-rays, they have low levels of radiation, so it's well monitored, and you wouldn't be able to have an issue. Really, I can confidently say you will not be able to have any issues there.
Thank you.
Yep.